Developmental trauma is often misdiagnosed as autism spectrum disorder, ADHD, other mental health disorders. From your perspective, what are the key differences speech language pathologists should be looking for when considering differential diagnosis?
Case history. I think that's the number one thing, is that if there is a history of any of those adverse childhood experiences, we have to consider that that may be the etiology or be the cause of what behaviors, what dysregulated behaviors they're seeing. So I would say case history is number one. I would say the second thing is trying to determine the kind of dysregulation that your client or patient is experiencing. I kind of see dysregulated behaviors kind of in three areas. Sensory, and so those tend to be your kids with autism spectrum disorder. I see behavioral dysregulation, which I would say are probably more of your mental health, anxiety and depression and all of those diagnoses that are related to mental health. And then I see developmental trauma as emotional dysregulation. So they're getting triggered by memories that are stored in that basement of their brain, the brainstem, which holds on to all those emotional memories that trigger their dysregulation. Not only do they function mostly in that kind of fight, flight, freeze, fawn of the lower part of their brain. They're stuck there and it's overused. So they just don't get to that higher level development. So number one, case history. Number two, figure out what kind of dysregulated behaviors you're actually seeing. And then I think beginning to recognize that a lot of these kids with adverse childhood experiences never got to experience co-regulation the way that other children do. I love, giving the example of, new babies. What do we do? I mean, we instantly pick them up. We talk to them. We give them a little bit of sensory input and say, shh, 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 you're okay. You're okay. That's all co-regulation that a lot of these kids who were internationally adopted or in foster care or who were abused never went through co-regulation. So recognizing and buying into that to help you then get to the most appropriate diagnosis.